I'm going to be sharing what Taylor and I pay for our policy. The bill just came due this month, and what that policy includes. You'll also hear from my own insurance broker, Santiago Fernandez, about the differences between public and private healthcare in Mexico and what shocks foreigners about private health insurance in Mexico. Across Mexico, there are more than 5,000 hospitals. The majority, around 70%, are private facilities and the rest are public. Residents can use their CURP, which is their Mexican Social Security number, to enroll in the public health program. Yes, there is some really quality care to be had at IMSS facilities, but IMSS hospitals are also known for notoriously long wait times.
If you have some issue, you can go to the IMSS, that is the name of the public health here, and they can tell you that they don't have space and they can take your case in 2 weeks or 1 month or 2 months maybe. If you have cancer, they can tell you, you know what, we don't have space. Come back in 4 months and we'll see. In 4 months, maybe you are dead.
Compared to public hospitals, private hospitals in Mexico have much shorter wait times. It's likely that you can get an appointment to see a specialist within a few days, and if you need to have surgery, that surgery will be scheduled within weeks, most likely, of the initial consultation. I spoke with Jenny Hart, a New Yorker living in Mexico City, about her experience navigating Mexican healthcare after she broke one ankle and severely sprained the other.
I ended up contracting one of the top, if not the top, orthopedic surgeons in all of Mexico. And he was, he's like, you need surgery and we need this to happen ASAP. I think that was like a Tuesday, and I immediately called the surgeon back, and my surgery was scheduled for that Friday. So it happened pretty quick. Almost my entire medical team was bilingual, and so they were able to explain everything to me. People were super compassionate. The room they gave me, I spent just one night there. I stayed overnight, but I got what would be considered like a suite in the US that I would never have been able to afford at a hospital. The facilities were really excellent. The care was really excellent. I think cash, like just the surgery and like the hospital stay, so not including all of the things before or after, but it came out to about 14,000 US dollars. And again, that was the total price. I think it would have been at least like 50 or 60 in the US, right? But because of my health insurance, I only had to pay about 2,000 US dollars.
Even though medical care in Mexico is relatively affordable compared to a place like, say, the US, a catastrophic event, think heart attack, cancer diagnosis, serious injury in a car accident, something like that could still bankrupt you. My conversations with Jenny and Santiago really hammered home this major difference between healthcare in the US and healthcare in Mexico: payment.
I don't know about the public, but the private, they will not even give you a second glance unless you have your payment figured out in advance. Like, you could be bleeding out, and it's like, if you don't have cash or like a means to pay for it, like, they will not see you, which is very different from, in the US, like, ethically, the hospitals have to see you whether or not you have the right to pay. In Mexico, they do not.
In the United States, I think I have clients that they go to a hospital, you take your card from the insurance company, they make what they need to do in the hospital, and 2 days later you go out, and they don't ask for credit card or something. Some hospitals, no. Here, as you enter the private hospital, they will ask you for the credit card. If you don't have insurance, private insurance, they will tell you, okay, you will need to pay for the entire check. If you don't pay, you can't go out. So if you don't have insurance policy for private hospitals, then you need to know, if you have an accident or something big, you will need to pay a lot of money. In the moment, they don't tell you, oh, okay, go to your home and we'll send you the check later by email. No. You need to pay me here right now.
Everything was I had gone through, like, it was like almost a couple hours of like intake paperwork, and like everything was already squared away between like the hospital and the insurance company. But then they were like, no, we won't let you leave until we receive the funds from your insurance company. So not all, like, them like having like a contract and everything being approved didn't matter. They were literally, there was a guard standing guard at the door of my hospital room, not letting me leave until this payment was processed. So I'm like privately calling my insurance, and they're like, hey, hello, how can we help you? I'm like, pay the hospital, let me go home. And I'm like, and they're like, let's see what's going on. And so it's like, they were like, I have no idea what conversation the hospital was having with the insurance, but I'm like separately on my cell phone calling customer service. And I'm like, listen, they won't let me leave. Like they're like, what's the update? They're like, oh, well, someone said it's being processed. I'm like, process it now.
That's what we do actually. We are not the insurance company, but we are the intermediates between the client and the insurance company, and we are always sitting in the side of the client. So when they are in the hospital, we are looking that the insurance company make the payment so the patient can go home, right? But because if the insurance company or you without your insurance policy don't pay, as I told you, they are not going to leave you.
If you think that you might want to work with Santiago or just get an idea of what a health insurance policy in Mexico would cost for you in your situation, I will be sure to leave his contact information in the video description.
I have already 2 or 3 people from the United States. I think they come from you. That I make the quotes for them. They were like 60 maybe. And they were like, oh my God, they are very expensive. And it was not that expensive if you compare with the United States. But the problem is that people think in the United States they are going to come to Mexico and they are going to tell them, oh yeah, 3 pesos for the insurance plan, no? $10 for all the year and you are covering the best hospitals in Mexico City. That's not the reality.
So how much does a private health insurance policy in Mexico cost? Age is a very important factor, as well as the type of hospitals that you want access to.
For example, here in Mexico City, we have 5 top hospitals: ABC Observatorio, ABC Santa Fe, Hospital Ángeles Interlomas, Hospital Ángeles Pedregal, and Médica Sur. That 5 are the best hospitals with the best doctors, with the best machines and everything, okay? If you want some plan with that hospitals, it's going to be expensive. If you don't want that hospitals, it's going to be cheaper, depending on the type of hospitals you want.
I mentioned at the start of the video that our bill for our health insurance just came due. We pay in 2 installments annually. So we pay in January and then again in July. The January installment, the January bill, is for 21,727 pesos. That's for me and Taylor, and it comes out to around $1,000 US. So just double that for how much we pay as a couple in health insurance annually. With this specific policy, I pay for prescription medication and doctor's visits out of pocket, since a single medical event would need to cost more than approximately $1,000 US for GNP to reimburse me under this policy. Before you ask, this plan also covers me for emergencies that happen when I'm traveling, including trips back to the US. GNP, Grupo Nacional Provincial, who we have our policy with, is a company that Santiago recommends to a lot of his English-speaking clients because the documentation is available in English, which is super important for understanding your policy and finding the information that you need.
We're with a good health. We don't think about that prevention, no? Let's say prevention. You are like, everything is okay, and I don't need that. I don't need a good insurance policy, maybe the cheap one, no, because I'm okay, no? And when something really bad happens to you, an accident, cancer, I don't know, many big problems that we have day at day from clients here in Mexico, then you want to have the best insurance policy that covers the best hospitals, because it's your health. If you don't have health, you don't have nothing in life. That's the truth. If you wake up tomorrow with health, you have everything.
Unfortunately, not everyone is going to qualify for private health insurance in Mexico.
Very important. If you have pre-existing conditions, if you have diabetes, some type of cancer past, high blood pressure, there's nothing we can do. Over 65, we can't do nothing, okay? Someone 65, 66 want an insurance, here we can't do that.
If you don't qualify for private health insurance in Mexico, then the best thing that you can do is try to maintain, if at all possible, coverage in your home country. Then look into options for companies that would provide transport back to your home country in the case of a serious medical event. They would make sure that you get home for the care that you need. My friend Yvonne Pavan over at Host Relocation told me about one such company, SkyMed, and I will be sure to put a link to their website in the description below so you can learn more. As someone who wants to live a whole lot longer but doesn't have hundreds of thousands of dollars to spend on medical bills, I definitely think private health insurance in Mexico is worth it. If you have any questions about private health insurance in Mexico, I'm not an expert, but I know one. Leave them in the comments below and I will do my best to answer them. I'm Alex from backpackingbrunette.com. Thanks for watching.